What is the full form? You know, bacillus convert liquidity. This is a live attenuated bacterial vaccine derived from MBBS. It is reduces the risk of tuberculosis in people who are not infected with TB. It does not always prevent the disease. That's why we are still having TB disease. Okay. But this vaccine is very much effective, getting from CNS TB and miliary tuberculosis. Okay. And also another thing, it is more effective in children less than 6 years old, providing 50 to 80% protection against about 10 years. The vaccination is not recommended. This slide is not now valid because India government is starting adult BCG vaccination. Okay. Also in this slide, every line it is came from one or another MCQ. Okay. Either it came on PTI Chandigarh or in names. Some are easier. The MBBS, I think it came from maybe early the some question. Okay, others usually came in the multiple choice questions where multiple statements are right. The IICD, this pattern has been introduced. Previously it was pattern for only Chandigarh. Now this pattern has been introduced in the way I think we do not have this, but it is somewhat looks like this. If examiner gives you the is higher. Okay. What you will say? Suppose it is not written. Okay, this is ever higher. Suppose it's a BCG. What you will say? The examiner will give you the higher. I told her you do not have BCG higher here. It will be in the exam. So you do not read what is written in the level. First you describe it. Then you will say it is reading of level. That's what is it? This is the just simply say that this is the amber colored classifier. Okay. Amber color. Why amber color? Second color. Correct. And classifier you can be made of glass. Sometimes it will be given with Vaccine Vial Monitor, something this, that. And what it contains? You just say, sir, this is the amber colored classifier containing white powdery substance. This probably BCG. Okay, because other vaccines should be in the white form, but in our IICU, only BCG comes with amber colored bottle and powdered substance. Okay. Rotavirus also, you will let us say rotavirus also has amber color, but it will be come in a liquid sometimes. Also some additional information, the BCG is previously used in the treatment of superficial forms of bladder cancer. It has protective effect against some non-tuberculosis mycobacterium like mycobacterium bovis. It also cause sometimes infection in humans. Okay. Also in leprosy, it is a BCG has a protective effect against leprosy in the range 20 to 80%. And Buruli ulcer, it may protect against or delay the onset of Buruli ulcer. It was came in the I think FMC or JIGMA. This question has come. Now coming to the doses, the vaccine is given just under the skin internally, usually in the left upper arm. Now it is a single vaccine. Previously in our parents' time, it was a multi-needle injector. That's why their scar was some larger. In our case, the scar is very small. Sometimes the scar also disappears. No other vaccine should be given in the same limb as the BCG for 3 months afterwards because of the risk of lymphadenitis. Okay. If the exact site it is asked in the viva or exam, that is the insertion of deltoid. Okay. What is the dose? 0.05 ml for children less than 1 year, 0.1 ml for children more than 1 year. BCG vaccines are freeze-dried vaccine and glass sample has to be opened slowly to prevent the airflow from blowing out the powder. Then the powder has to be diluted with saline water. Or sometimes as another solution is given, it comes with the BCG vial itself. Okay. Okay. Another question. If you got a child who do not know the age, and there is an orphan child. And you on examination you do not see any scar. If the child is somewhat older, 9 months or something, will you give the children this child disease? You do not know orphan child found in the streets, no BCG scar. Will you give the child BCG or not? Whatever, yes, no, whatever you think. Anyone? Hand against your knowledge. Either this will happen in practical field. You are sitting in the chamber, sometimes that doctor, oh, this is a child we found, do something. You cannot adopt. Okay. What you say, okay, I am doing this and some injection, some drops. Okay, now take it to police station. Sometimes police will bring the child. Suppose you are in later, you are a pediatrics PGT in combat hospital. Okay. So no protection. Police will also charge you. Do something. What will you will give the BCG or not? Simple question. Yes. Because the child might have TB or not, because TB symptom is not expected. Another question, it is asking why. If the mother has active TB, okay, mother is not registered previously, also some, you will see in real life, some কোনো পাগল হচ্ছে আছে এসছে পাগল প্রেগনেন্ট হয়ে গেছে কিছু করার নেই তার সামনে হঠাৎ করে পাগলের কিছু টেস্ট করা হচ্ছে দেখা গেছে পেশেন্টের অ্যাক্টিভ টিবি এবার ইও হবে বাচ্চার প্রত্যেক গিয়ে বা যখন ডেলিভারি হবে will the child be given BCG or not? Yes. Because there is some disease that is congenital TB. We do not have the facility in any medical college to detect that. But যখন বাচ্চাকে আমরা মায়ের সঙ্গেই রাখবো তখন বারবার টিবি হওয়ার থেকে শুরুতেই BCG দিয়ে দেওয়া হবে এখানে ক্ষতি কিছু নেই গাড়ি লাইভ ভ্যাকসিন দেওয়া লাইভ টিবি দেওয়া হচ্ছে যদি অলরেডি টিবি হয় ইট উইল জেনারেট ইমিউন রেসপন্স বাট টিবি হয়ে গেলে চিকিৎসা করাটা তার থেকে বেশি ডিফিকাল্ট বিকজ অল ড্রাগস আর ভেরি মাচ হেপাটোটক্সিক coming to the solution, either it is sodium, potassium, magnesium salt, sometimes contain glycerol, sometimes contain citric acid. There are some brand names from where our Indian government usually buy the BCG vaccines. That is Therasis or Tice. Storage. Remember, BCG vaccine, prepared BCG vaccine is the most heat sensitive vaccine. Okay. There are some MCQs that it will be given options. Which is the most heat sensitive? Usually OPV is there and you will mark OPV. But sometimes you will see there are another option. Prepared BCG vaccine. Can you mark that? Because that is the most heat sensitive vaccine. And also BCG vaccine is somewhat heat sensitive also. So it should be stored in the 2 to 8 degree. Not less than, not more than that. Okay. And it also contains live bacteria, so direct sunlight exposure may destroy the bacteria. Okay. Also, in another information, in heat sensitive vaccine, the vaccines which has P in their name, okay, the P series vaccine, those are heat sensitive. Okay. If the MCQ comes later, we will mark that BCG. Now coming to the stages after giving the BCG vaccination, first the child is vaccinated. Also, I already told, but also that BCG 0.05 it can be given up to 1 year. After 1 year it is 1. So if the child comes 3 or 4 years old child, you will give him BCG, but the dose will be double. Now after 10 weeks there will be some shallow ulceration with crusting. Okay, the crusting you should measure because if it is very much larger, then you will suspect the child might have congenital TB or child actually has contracted TB early. After 3 weeks, there will be the previous one was crusting blister. Then at the 3 weeks, there will be a small area of redness. After by 14 weeks, it will disappear. And at the 6 weeks, it is reduced to only raised papule with slight redness. And 14 weeks, the healing has started. But if the healing by 14 weeks also did not start, we will relate the child has contracted TB. And what are the adverse reaction? Sometimes very common, but the very common side effect, that is hardness at the injection site followed by a raised blister. Okay, blister sometimes raise too much and it will make it hard. Usually it occurs due to ineffective subcut injection, IV injection. Sometimes IV they might do subcut. Sometimes they even do deep IM, so it will be very painful for the child. Some uncommon fever, sometimes ulcer, swelling of lymph node in the heartbeat larger than 1 centimeter. What are the rare side effects? That is bone inflammation, that osteitis or osteomyelitis, more severe skin reaction, sometimes abscess at the injection site, sometimes disseminated TB, that is red papules all over the body. That is what not adverse, that is actually indicated the child was immunocompromised. Nothing else. What are the contraindications? One is obviously pregnancy. We are not giving adult vaccinations, so there. Sometimes allergy to any component of BCG vaccination. Some immunologic responses have been suppressed by the steroid or alkylating agents. Congenital immunodeficiency such as chronic granulomatous disease or intestinal trauma, leukemia, lymphoma, generalized blindness, nothing can you detect in the very early in the life. So we usually give the BCG blindly and later we think whatever may happen. Nothing we can detect in our setup very much early in the pregnancy. Okay, that was for BCG. Coming to the polio vaccine, we know 2 types of polio vaccine is there. One is OPV, one is IPV. What is the schedule of OPV? I think that one everybody knows. 0 dose,
6, 10, 14 weeks, 1 to
okay, then 5 years পর্যন্ত সমাজে একটা করে, তাই তো? আচ্ছা, ওপিভি তো লাইভ ভ্যাকসিন, সমস্ত লাইভ ভ্যাকসিনই একবার দিলেই কাজ হয়ে যায়। কিল ভ্যাকসিন বারবার দিতে হয়, বুস্টার দিতে হয়, বাট ওপিভির ক্ষেত্রে এটা কেন বারবার কেন দিতে হয়? তা আগের গ্রুপকে আমি হোমওয়ার্ক দিই, আর কি হোমওয়ার্ক না কেউ জানো উত্তর ভাই? চলো সেটা শুনো। ওকে, হোমওয়ার্কটা নেক্সট উইকে জানতে চাইবো। This is not this is a simple comparison between OPV and IPV doses. Should we use if it has some vaccine between? Should we use no? 4 stages are there. Up at the inner square is same brightness of the outer circle. We can use that. Then we will discard. Okay. In OPV vaccine, actually, circulate this is a very common sample. The examiner will give you. Okay. There are some other questions they will ask. First, OPV vaccine where it is kept in a sub-center. So what I said, after reconstituted BCG, OPV is the second most heat sensitive. So in the sub-center there is some deep liner feature, ILR. Okay, I will show you the picture, you will cold chain classes. In the bottom rack, there will be OPV. Okay. And when to discard, how it is discarded? All the batches of OPV fires which have been either emptied or the BPM swing you cannot be used anymore. It will be collected in a plastic bag and it will be kept in the top of the either vaccine carrier vial, cold box, those are cold box or INR in the top box. When the next segment of OPV or other vaccine will come, you will give them to those. Okay, they will discard it. You do not throw it here and there. Now coming to the OPV, there are three types of polio virus which usually affect the human. That is wild type 1, type 2 and type 3, and that's why we also created separate vaccines for each strain, monovalent. Then we use similar portion of each strain. That was trivalent. Later, now coming to the after 2016, we have excluded type 2 virus because wild polio virus type 2 we use, that is almost eradicated from the world. So now we are using bivalent oral polio virus, but in our two neighbor countries, they are still affected from polio. That is one is Afghanistan, second is Pakistan. That's why we again reintroduced IPV, which is the wild polio virus type 2 in Q4 variant. Okay, and IPV now has changed to vaccinated IPV. Previously it was given in 14 weeks directly. Now it is 6 weeks and 14 weeks. FIPD is given. This is a comparison table. I will come into the later. And this is a comparison table taken from PARC actually, that is IPV and FIPV, which is frequently asked in the Viva exam, and also it might come as a 4 number question. Why FIPV has been, why IPV or FIPV has been introduced, and why, what are the advantages or disadvantages of this. Okay. Coming to the any important topic. So what are the adverse reactions of oral polio? Question? Okay, that is one is VAPP, vaccine associated paralytic polio, and one is VDPP. It is vaccine derived paralytic polio. Okay. So what is vaccine associated and what are the vaccine derived? Vaccine derived usually the inherent fault in the vaccine, what are the OPV that vial has been used. Sometimes live attenuated, all strains are not attenuated properly. So, or the recipient is immunocompromised. So it will create a vaccine derived this polio virus. It may affect the community. First the child, then other child will be directly infected by the or if it contaminated the water. So three types of VDPV is there. One is circular, that is CVDPV. And also sometimes IVDPV is if the recipient is immunodeficient. There if exposed to OPV, then IVDPV is emerged. And something ambiguous, which is not they cannot explain directly, cannot be explained. Which is cannot be explained, usually we either say that as ambiguous or in medicine, some other term. Okay, and what is vaccine associated? Sometimes the oral polio vaccine is also given with some injections. Okay, not IPV or anything. So another vaccine, or for another cause the person is started developing some paralysis. Okay, those are not vaccine associated because it happened during vaccination. I will later show you AEFI that this kind of incidents you usually see. The person someday you are conducting a vaccine session and some person will come and say, sir, sir or madam, you have given vaccine and those child have started showing some convulsion that he cannot move his limbs, sometimes upper limb, sometimes lower limb. There are no explanation. And they usually blame you wearing a vaccination cap, nobody to protect you. So this you have to just classify the mob usually. Okay. The BCG are much more of research for the research topic than the BAPP. BAPP is nothing but the mob reaction. Okay. Now coming to the next another viva question, examiner will ask you how the OPV has been introduced. Okay. OPV কিভাবে দেবে? Hello? আচ্ছা যাই হোক, এটা হচ্ছে যে একদম সহজ কথা যে বাচ্চারা হচ্ছে দাঁড়িয়ে আছে কথা বলতে পারে তাদেরকে বললেই তারা হয় কিন্তু যারা ছোট বাচ্চা তাদেরকে কি করে দেবে ইউজুয়ালি বাচ্চারা যদি শান্ত থাকে তাহলে বাচ্চারা হচ্ছে গিয়ে এটা তারা অশান্ত আছে ঠিক আছে বাচ্চা যদি শান্ত থাকে তাকে বলে নেবে যেন সোজা থাকে মা যেন ধরে থাকে আমার কাজ হচ্ছে ফার্স্টে হচ্ছে গিয়ে বাচ্চাকে করতে বললেই করবে কথা বোঝানো হয় ফার্স্টে হচ্ছে নোজ পিচ করবে মুখ হয়ে যাবে অথবা থ্রোট হচ্ছে কি এখানে পিচ করতে হয় হবে তুমি হচ্ছে গিয়ে একদম টোটালি 90 ডিগ্রিতে হচ্ছে এটা ধরে থাকবে ভ্যাকসিন ভায়ালটা ডিসপেন্সারে অটোমেটিক্যালি দুটো ড্রপ হচ্ছে চলে আসবে এবং টু ড্রপস ওকে তো বুঝ জিন্দেগি কি বলে গেছে বিগবি This question usually asked examiner the exam it is written in the part okay now coming to the third vaccine which is hepatitis B. What is hepatitis? It is also caused by 5 virus species A, B, C, D, E. Among them, HPV usually transmission occurs perinatally, that is vertical or during very much early childhood or from sexual contact or nosocomically. HPV is a very much dangerous. It can be just like rabies. It can transmit to you from an open wound. Okay. And after this year, the next year you will enter intensive. Please get a hepatitis B booster. Okay, patient party usually do not will say, they will not announce. Sir, I have a hepatitis B. Usually, the patient party will tell you, sir, I have something to say. Please go to a corner and then he has some bad habits of going there and there. And bad habits. Usually, IV drug user, hepatitis B is very much common. Here I don't know what is the prevalence of IV drug. In Kolkata, when I was doing in Sealda, I have done some analysis. There are 2 IV drugs. And those all say, they will say, okay, sir, you drug into or ততক্ষণে আমার কিন্তু পেশেন্টের ব্লাড নিয়ে তাকে ভর্তি করা হয়ে গেছে আমার মাথায় বাজে আর আগে বলুন আরো বাছা কতগুলো ওয়ার্ড হবে প্লিজ when you are in intensive when you do any kind of blood taking or something use double gloves okay for your own safety and obvious and please get a hepatitis B booster. Okay. Usually now what MBBS we are using now in our NI Institute we are still using the heat stable vaccine. The active substance in which the viral surface protein that is HPS-AG. Okay. The vaccine is produced by now newer vaccine recombinant technology but adjuvants in aluminium salt and preserved with thiopursolol. Okay, in vaccine there are also some part what are the adjuvant, what are the solvent. This one you read from the part. Okay, It also should be stored at 2 to 8 degrees because hepatitis it has 2 T. So it is a very much heat sensitive vaccine. It usually available as monovalent formulation and in combination sometimes is DPT, hemophilus influenzae, and some other countries it is given as IPV. What is the protective efficacy? It is related to induction of antibody to hepatitis B surface antigen and induction of memory T cell. Anti-HBs condition of 10 ml international unit per ml measured after 1 to 3 months of administration of the last dose of the reliable polio. It is not done in our country, but it is done in other. Okay. You may expect this kind of question in INICET. Those two lines are taken from INICET questions. Coming to the doses, we are not talking about now the adult doses, but in children of birth dose it is 0.5 ml per 10 microorganisms, usually given in IM in children less than 3 in the anterolateral thigh, left side usually. If the child is more than 3 years old, what I said that orphan child, then to your side, where it will give? We will give in the delta and BCG. Usually BCG and BCG also left. This is also left. So what will be the distance? 1 millimeter. Okay, at least 1 millimeter, and you will give BCG is live and this is speed. So there will be no reaction. But the sign distance will be at least 1 centimeter. Okay, usually it is a very safe and well tolerated vaccine. And what are the schedule? NIS schedule that we usually remember. IAP, that is Indian Association of Pediatrics, we usually do not follow this. And what are the NIS schedules? 0, 6, 10 and 14 weeks. Other, I think the PPT will be shared with you, and these things came in the INICET exams. Okay, every statement. I do not choose any other polling statements. These statements usually came in the previous exams. That's why I chose this. I put this. Pre and post vaccination, they say it is not needed for you. Non-responder. Okay. This question usually they ask: if the mother is suffering from hepatitis B, how will you manage it? Okay, this is not related to the direct community medicine. This question you will expect in the Viva. Okay, read from the PPT or it is given in addition beautifully. If the after born the HBsAg load, either load it is calculated, it is measured through our series of blood work. Okay. And when the usually cross the threshold level, we start hepatitis treatment. But the question says we will give the hepatitis B vaccination or not? Actually no. Okay, the chance of vertical transmission is very high. We usually avoid. This is the management. Post exposure, which is reading, is very much useful for you. Cat vaccination is not needed. Coming to the EFI, adverse events following immunization. Okay, in some, this year, I think EFI came as a question, first paper. Somebody wrote as adverse effects. Okay, that is not effect. Effect is a very small thing. You give injection, you can injection into. দেখলে হচ্ছে গিয়ে পাশে হচ্ছে কি দাম করে একটা আওয়াজ হলো কি না বাচ্চাকে তুমি ইনজেকশন দিচ্ছ বাচ্চার মা পড়ে গেল দ্যাটস এ ভেরি স্মল এফেক্ট গায়ে আসা কথা পাশে দিয়ে হচ্ছে গিয়ে ভয় পাই ঠিক আছে কিন্তু ইভেন্ট হয়ে যাবে কখন যদি ওইরকম দেখলে 10 জন মা পড়ে গেল আমাদের একটা কাট হয়ে গেল তারা বাইরে গিয়ে বলবো বাচ্চাদেরকে খুব বাজেভাবে ইনজেকশন দিচ্ছে বাচ্চারা খুব কাঁদছে ব্যাস তখন দেখব প্রত্যেকটা লোক জড়ো হয়ে গেলে এদিকে বিপদে পড়লে পাবে না কাউ লোক জড়ো হয়ে যাবে এসে তুমি হচ্ছে গিয়ে ওখানে একমাত্র এগো হয়তো তোমাকে পাঠিয়ে যেতে চাও আমি আমাদের না একজন তো যেতেই হবে তুমি যে ডিসিপ্লিনে নিও হবে না তুমি হয়তো ভবিষ্যতে রেডিও থেরাপি করছো ওগুলো যদি সরকারি চাকরি করো তো যান স্যার আজকে ভ্যাকসিনের ইয়ে আছে ওটা আপনার ডিউটি এটা করতে হবে আমরা সবাই হচ্ছে কি করবো বলেই চাকরিতে ঢুকেছি সরকারি চাকরি তো লেখা থাকে অনেক তলা ঠিক আছে আমরা সবসময় পড়ি আমাকে একটা বছরে হলেও করতে হবে তুমি ওখানে গিয়ে দেখলে এইটা হয়ে গেছে ব্যাস so what is the EFI adverse event following immunization is any untoward medical occurrence which follows immunization and which does not necessarily have a causal relationship with the usage of the vaccine. The adverse event may be any unfavorable or unintended side, abnormal laboratory finding, symptom or disease. সব সময় যে কজ থাকবে এমন নয় আনকজের চান্স সবচেয়ে বেশি হয় তো স্টিল ইন 2012 WHO AFI কে পাঁচটা কজে ভাগ করে দিয়েছে দ্যাট ইজ ওয়ান ইজ ভ্যাকসিন প্রোডাক্ট রিলেটেড রিঅ্যাকশন সেকেন্ড ইজ ভ্যাকসিন কোয়ালিটি ডিফেক্ট রিলেটেড রিঅ্যাকশন থার্ড ইজ ইমিউনাইজেশন এরর রিলেটেড রিঅ্যাকশন fourth is immunization anxiety that I said earlier and fifth is coincidental effect আরো ডেঞ্জারাস এটা আমাদের লাইফে দেখা আছে ঠিক আছে আমরা হচ্ছে ইন্টার্নশিপে আমাদেরকে যেতে হয়েছিল বালুপুরের কাছে একটা জায়গায় উনি ভ্যাকসিন হচ্ছে হঠাৎ করে শুনলাম খবর এলো যে আমরা ভ্যাকসিন দিচ্ছি তো ওই দিকে নাকি 4টে বাচ্চা অসুস্থ হয়ে গেছে খোঁজ নিয়ে জানা গেল বাচ্চাগুলো কিন্তু ভ্যাকসিন নেয় তো ওরা অসুস্থ হয়ে গেছে ব্যাস আমার দোষ হয়ে গেল কিছু কিছু জায়গায় তখন ঘুটিয়ে চলে আসে সায়েন্সের ওখানে যুক্তি নেই কানটা দাম নেই আমরা হচ্ছে গুটিয়ে জাস্ট সেন্টারে এসে জানিয়ে দিলাম নিতে চাইছি আমরা চললাম ইন্টার্নশিপ তো দায়িত্বও থাকে না নিজেরা করার জন্য আমাদের পাঠিয়েছে আমরা বলেছি আমরা পারবো না চলবে আপনারা বুঝে নেবেন সেম ফার্স্ট ভ্যাকসিন প্রোডাক্ট রিলেটেড রিঅ্যাকশন example what extensive lip swelling following DTP vaccination okay the same question what is the acellular participant why it is now acellular previously it was cellular and DTP is usually a very painful injection because in adjuvant it is I think use some lipid kind of substance okay that's why it's very painful so this vaccine usually what is the cause this is the inherent property of the vaccine it is expected. Now coming to the vaccine quality defect related reaction that is delivered by the manufacturer. Same goes by as I said in the BDP. The batch of the batch of the vaccine is not correctly produced. This is quality of vaccine. Sometimes the administration device is also faulty. I think if you have followed the newspaper, there is something bad that came on from rabies vaccine. Aware false. They are telling false. They are telling that some counterfeit agency are making the same thing and selling in the market. Obviously, administering their own fault is very much disastrous. They will get sued. Now, immunization error, which is the transmission of infection by the contaminated multi-dose vial. Okay. আমরা হচ্ছে কি এই যে OPV নিয়েটা দেখলে ভাইরালটা পুরো বাচ্চার ঠোঁটে ঠেকিয়ে দিয়েছে এবং বাচ্চা হচ্ছে কি কোনো ডিজিজ হচ্ছে কি ক্যারি করছিল এটা হচ্ছে আরেকজন বাচ্চা খেতে চলে গেল that is the immunization error or sometimes যে বললাম ইনজেকশন দিতে গিয়ে এমন ইনজেকশন দিয়েছে ওটা হাত দিয়ে পড়ে গেছে আমাদের ক্ষেত্রেও হতে পারে তুমি টিটি নিতে গেলে সেটা হচ্ছে এমন ছিল তুমি হাতটা নাড়াতে পারছো ওকে আর এটা এখানে পড়েছিল হোয়াট ইজ মানে কি অ্যানাস্থেসিয়া বলে এটাকে যদি টেলটয়েডের ফুল ইনজেকশন হয় ডিমান্ড আগামীতে ছিল তো সামথিং রেজিমেন্টাল ব্যাচ কি পড়ে ওকে এন্ড দ্য কোইন্সিডেন্টাল ইভেন্ট দিস পয়েন্ট ইনজেকশন অ্যাংজাইটি the vasovagal syndrome in an adolescent following vaccination. Okay, এই ক্ষেত্রে দেখা যায় কাঁপতে কাঁপতে শুয়ে গেল HPV therapy injection নিজেই দেবো বলে যেই দেওয়া হয়েছে হঠাৎ কাঁপতে শুরু করলো বুঝে শুনে ঠিক আছে আর কোইন্সিডেন্টাল তো বললাম okay again coming to the first vaccine product there is one interesting case study that is Qatar case okay focus in the highlighted area what is written in 1955 after administration of the inactivated polio vaccine that is IPV manufactured by Qatar laboratory in the US 40,000 people developed abortive polio 200 were permanently paralyzed and 10 died. Investigation revealed that two production pools of 12,000 doses contained the live virus. Okay. So what kind of reaction in AEFI was that? Product related or quality defect? Product. Product. Right product. What is the product? That is inherent property. We expect this, it might happen. But it is simple quality defect. It is written in IPV, Inactivated Polio Vaccine. It should be dead, but there were live bacteria. So it causes polio. It is written in the vaccine quality defect. Okay. Now coming to this is a very again the vaccine reactions. Separated into two. One is common minor and second is rare and serious. What is common minor? What I said, redness and swelling of the limb. It is usually occur within a few hours of injection. Resolve after short period. Sometimes systemic some symptoms are used, that is fever, malaise, headache, myalgia, loss of appetite. Anything, but it is resolved within days. Or usually do not need any intervention. This is a sort of page taken from part. See, every vaccine is given by injectable form in the lab. Okay, oral vaccine usually do not show common minor reactions. This part page number 128. And coming to the rare and more serious reactions. It is also one short note and usually asked is given in the part when the AEFI is considered as serious if it results in death or life-threatening condition or it requires hospitalization or prolongation of existing hospitalization or results in persistent or significant disability or requires in active intervention. Okay, then it is rare and more serious. যদি বড় কিছু হয়ে যায় then it is rare and it is more serious and usually it is rare that's why আমাদের আপাতত NIS এর যতগুলো ভ্যাকসিন আছে ওগুলোতে এগুলো চট করে হওয়ার কথা নয় and it is also given some rare and serious reactions the error what I said that ভ্যাকসিন ঠিকমতো হ্যান্ডেল করতে না পারলে হচ্ছে যা হয় হ্যাঁ ডিভাইস প্রবলেম হতে পারে অথবা ভ্যাকসিন হচ্ছে ঠিকমতো হচ্ছে কি ফ্রিজ করেনি ঠিকমতো করে বানায়নি যখন প্রিপেয়ার করতে হয় তখন হচ্ছে কি এক্সাক্ট পাউডারের কতটা হচ্ছে কি যতটা আছে কতখানা সলভেন্ট দিতে হবে তার থেকে কম দিচ্ছে ভ্যাকসিন ইজ নট প্রিপেয়ার্ড প্রপারলি দ্যাট ইজ ইমিউনাইজেশন এরর ভ্যাকসিনেশন এরর যদি বলে যে হোয়াট ইজ ভ্যাকসিনেশন এরর দ্যাট ইজ ইমিউনাইজেশন এরর রিলেটেড রিঅ্যাকশন ভ্যাকসিনেশন রিঅ্যাকশন যদি বলে ওকে what are the things? These are non-sterile injection, injection error, incorrect site, transport or stored incorrectly, contraindications ignored. Okay, একটা কি উল্টোপাল্টা কাজ করলে কি কি পসিবল AEFI হতে পারে সেগুলো হচ্ছে কি দেওয়া আছে and again what I said anxiety coincidental event then now there is simple vaccination what kind of intervention what kind of prevention primary every time and why primary why not primordial
respective